myself and the street doctor,
Thank you very much.
Dr. Suarez, have brought a resource person to come and help us with the discussion. The person of someone I describe as my sister, Dr. Appiah.
Woo! Appiah.
All right, you. But Appiah,
Yes.
he's our street doctor.
Yeah, the best.
He says everything I say.
Tell me everything you hear on the street.
Sure, I'll tell you.
Yes.
Let's
Because
think.
I don't roam on it a lot, so
I'll let
Let
you.
me know.
No, that's why I'm there. I'm your eyes on the street. Don't
sure.
worry.
So today we're going to talk about infertility.
Sure.
It will not end there anyway. We are going to discuss issues of pregnancy. So after talking about infertility, if by the grace of God you end up
I'm
getting
fertile.
pregnant,
Okay.
what are the do's
And
don'ts of
The merit and demerit.
the merits of pregnancy? Suarez,
Thank you very much.
what's up?
With the inside.
Issues of infertility. Do you know any family or somebody who has battered?
Oh, a lot.
Not what will be breed.
Maybe my
Oma buy 5 million.
Oh,
So do we have-
there 5 million.
Yes, 4 point something.
1.3.
Make that thing kind.
Can I wait?
Blessing. Say blessing.
Bless them back.
I bless you, Unia. Man, does
But I mean, I'm confused. I'm fighting infertility.
infertility. Yeah.
When starting kind.
There be.
I come back as old, but I was yeah, infertility. There, idea. I mean, from boy number years or idea on that.
No, start with definition for infertility.
Infertility is when you are unable to be fertile, to give birth or something like that.
Okay.
Infertility is the opposite of fertility. To be fertile, how if you are able to conceive and give birth, you are fertile.
Dr. Appiah,
Okay.
you define infertility for us in your own terms, not necessarily a very technical.
And
Okay.
The other kind is street definition, or my NTA professional definition.
Okay.
now, tia,
So infertility, or when we talk about infertility, we are talking about a couple's inability to have any conceive.
Wrong.
They are not able to conceive.
it's a wrong.
See, and not necessarily say when they
It's
conceive,
wrong.
they have to have the baby first. But at least
Doctor,
I was saw a year pregnancy test. Now I say I'm positive. Well,
that's what
Abra.
I say. Infertility doesn't start with couple.
The answer,
That's with one.
let's start with the.
It starts with a human being.
na say
Now,
human
say
being no
the man,
you can
couple
couple
you
la.
two. It takes 2 to get pregnant.
Okay,
Who told
you
you?
defining
Couple
you
just
can
say
say
matter-
oba.
Sometimes take 3.
Fair enough. One can say
Yes.
married couple. What's a couple?
But ebu anomanya couple.
How many are they?
One night stand.
Couple are couple.
So
Ah, there you go.
at that point,
And you're
And I
married
win
couple.
And then say any
say
English couple.
make a couple I mean
The couple are interested in married
And to me
people.
repeal be no or
At that time,
we are couple.
No, couple you're brofu. Couple you 2.
Yes, and I'm making to me end part 5 you could repeal.
no, say what you say. When you say nipa mienu na pregnancy ba oba ni be man, let me clarify because
Good.
you say me ba.
The bull guy.
Clarify.
It's I say oba any obema. It's say one night stand cry e oba ni obema for this instance no
They are
we a
couple.
couple.
I don't.
Say la
So, okay, you redefine the LMC.
definition no yeah.
Okay.
Yeah.
Inability of.
The inability to receive or conceive. That's all.
Hey, what definition where there?
Because all the total ABR has a fertile land. It has to be a fertile. All the seeds it may germinate, it may grow. Until we all nipa or bar now only fertile. It will be too much and germinate.
Now then the show say at the end of the show on because se bi wo ha seed ni bi wo ha and you good.
But it also good because not everybody that gets pregnant had sex.
Hey.
Do you doctors agree?
Well, in terms of sex, yes, but say you what? Say any technology about it to me.
So how do you define infertility with couple?
Oh, say in this case,
Me.
no. Oba din the egg beba, na be ma din the sperm aba. Near the abom.
That's what can we be having.
Yes, maka baby.
Until the tie me definition of infertility no. It's in the clinical terms, you can say a couple is infertile. In this case, no bani or bema. You can say they've been staying together. They've been having regular sex. Regular sex, you know, it's one say more than 3 times in a week. Now, it's unprotected. So, omu use condom, omu use anything that would cause a barrier. Now, after 12 months of that kind of act, you know, still a bambai, then we call it infertility. They say no, so cry. Yes,
that definition is being
yes,
put
son
in the letter,
kakra.
but the popular definition is that there's a couple, a man and a woman, they have penile-vaginal sex. So there's penis involved, there's vagina involved. They have regular intercourse. By regular, the definition is at least 3 times a week. And they have done this for like 1 year, and there was still no pregnancy. So you see that it's not just a matter of I went to have sex like 2 times and I didn't get pregnant, or I've had sex 1, 2. No, there are some metrics that you need to satisfy in order for you to consider yourself infertile. Remember, 1, there should be a man and a woman.
A woman.
2, there should be what?
Penis.
Vaginal.
And vagina.
Coming together. 3, there should be regular. 4, it should have lasted for at least
a year.
If you are 35 years and above, they may say 6 months.
6 months, yes.
But if you are younger than 35. So for us to make a definition for somebody being infertile, in this case, these are the things that we want you to satisfy. And then we can say that.
So are we saying that one person cannot be termed as infertile?
No. It takes 2 to
It takes
come.
2.
So 2 people have to be fertile.
No, that's not what you're saying.
What is the opposite of infertile?
Fertile.
So 2 people are fertile.
I don't understand.
Okay, 2 fertile people coming together.
So can one person be fertile or not?
Hey.
Okay,
who's say no?
No,
Look, on the streets, a man is supposed to have the title of potent.
Potency.
Potent. And Obani fertile.
Okay.
And see, if there's anything called infertility in a marriage or in any relationship,
It is just the woman.
it's for the woman. Potency is for the man.
Oh, okay. I understand where he's coming from.
I don't understand this, but you let me give him the benefit.
No,
Women understand us
infertility. Only explanation is a man is potent,
Yes, good.
and a woman is
Issues of infertility.
That
Yes.
has to be fertile. It
Yes.
is like you're defining infertility, and not just say only the woman.
Yes, and the man will be impotent.
Okay.
But impotent,
But those
and
are
also
just,
on the definition.
those are just semantics. It's just the use of the.
That's what
it's just-
I know.
No problem. But
So
that's why.
give the clinical one again, the definition again that you are giving. Give it to us.
You know what I admire about you and the street is that you try to bring things into perspective for some of us
Yes.
who have not had the privilege of listening to the street talk a lot. So I admire that. One thing I also want you to admire from us is that we are trying to shape that definition.
That's what I'm saying. Repeat the clinical one.
But
that
I
you
have said it. And
So you can repeat.
I know you can repeat it. Let's go.
So yes,
Let's go.
you heard.
Repeat.
No,
Okay,
what
what do
kind
you
of-
remember? What do you remember? You tell us what you remember.
Anything, the whole show.
Dr. Appiah, help us.
So now when you go to the streets, okay,
You will tell
so
them
when you are
that-
talking about infertility and they are saying that it's only the woman, you tell them that no, it's a couple. So a man and a woman who are having regular,
Last sex
let's say,
Unprotected sex.
unprotected. It also has to be vaginal.
and penicial.
And they've been doing that more than 3 times a week.
Okay.
And for the past 12 months or 1 year, they've not been able to conceive. But then the definition also changed for women above 35.
Okay.
Because we don't want to miss a whole year. If a woman is 35 years and you want to wait till a year when she's 36 before, maybe she has a problem you're trying,
Okay.
or the couple has a problem, you're trying to find a problem, then you are wasting time for the woman. Because at 35 years, you are considered elderly. A little bit elderly.
So that's
in
the age
terms-
cap for women.
Yes, so
How about
6
men?
months.
How about men?
For men really don't have the
So you
time.
see why we think that fertility is for women.
Well, what you are saying is think, but let's talk about facts here. Now, the fact is that causes of pregnancy, 3 things. It could be from the man, it could be from the woman, it could be from both of them, or we don't know the cause. In medicine, if we don't know the cause of something, we call it idiopathic.
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 So, technically,
In medical terms, if we don't know the cause, it's called idiopathy. Or
idiopathic, yeah. So, Dr. Appiah, we know this.
Yeah.
That if a couple comes and then they are described as infertile, it is not just the man.
Or
the
the
woman.
And
woman.
it is not just the woman, classically.
Yeah.
So we have to investigate and make sure that the man is fine, the woman is fine, or otherwise.
Yeah.
You understand?
Yeah, I get what you're saying.
So we have a lot of women rather coming in the clinic talking about they've not been able to get pregnant when they got married and all that. So we advise that they have to come with their husbands. Sometimes the husbands don't come, which is a bad thing because sometimes it can be from the other partner.
That's intriguing if you ask me, because in the investigation of infertility, it actually starts with the man.
Yeah.
You don't just go. Hardly would you just go and start with the woman and investigate the causes. You start with the man because the man, it is basically just one test you want to do, and be sure that this person.
And what test?
But for the woman, it's a lot of tests you will do. So why don't you start with this basic? Just get the man, do one basic test, and the name of the test is called a semen analysis.
Semen analysis.
Yes.
But you see, the men do not want to subject themselves to this kind of thing because it will cost him.
To cost him what?
Yes, money to do the test.
But it will not cost the woman money to.
Listen to me. I'm married to you. I'm chopping you. You're not getting pregnant. You want me to go and pay and do a test when I can cut a Nira and chop her and give you evidence.
But what shows?
So if I chop her to,
so when you chop her to an extent and the pregnancy is not coming, that's when you give yourself.
Yeah.
But why do you?
Why is it cheaper?
It's cheaper.
Because Nira will demand things. A lot of them demand a lot of things, which I'm sure the test, if you go ahead and just do the test once.
Indomie.
Oh, no, but I think that is not a right way to go.
See, if you go to the Bible, look at the oldest couple that we have in the Bible. That's Abraham and Sarah. What happened? Abraham they knew that they were having a problem. But
it wasn't Abraham who decided to go. It was the woman who pushed it.
She loved her husband.
But in this case, it's different.
Are you in any way defending the fact that men should not follow their wives to the hospital?
Yes.
That's your defense.
Yes.
That they should not go.
They should test. It's called litmus test.
You see the problems that came after Sarah allowed Abraham to go.
Jealousy.
At the end of the so would you want the family to go through all that?
No, I want to prove to you that it's not my fault.
It's a proof.
So don't go to your doctor and come back and tell me that doctor said we should come together. No.
You see, we also have to understand that in the cases of infertility, it's very emotional. Yes, so you wouldn't want to do anything that would cause the woman to stress more. Yes, so I think being a supportive husband is very necessary for the woman as well, because stress in itself can even cause.
I agree with you perfectly here. But apart from that, the man should know that he could even be the cause.
Yes.
Because the science is telling us that it is either you or the woman.
Yeah.
It's not necessarily just. So if there is an issue, it's only right that you follow your wife to the hospital and allow the doctors to work.
Yes.
That takes us to the causes of infertility. So we're going to take it one after the other. For a man, what can make you infertile? For a woman, what can make you infertile?
Okay.
Suarez, what do you have to say about this?
For a man, we have about 4.
About 4 things.
Apart from curses.
Curses.
Yes. They curse you. Your ex.
So there's spirituality and answer.
Yeah. If you go and misbehave with some girl and you leave her, you go and marry. That's your last.
Hey, I will say yes, steady, because.
But aside that, what we know, physical is heat.
Heat, yeah.
If you wear cotton box supporter, and there be a pampers and it's a benwa or bosom.
Hey.
So you see, instead of it being raw egg, I done it because you animal.
Because you animal.
Yes. And men's rate. Yes.
No, the fun is actually in the fact that there is an item of truth.
Yes.
Every time I say anything, it's true.
There is small truth.
And drugs, excessive use of drugs.
Okay.
Both for sexual enhancement and even the ones that take to work and all that. If it's too much, it can reduce the sperms.
Okay.
Good. And then one bit I forgot, but you can continue.
But I mean, Dr. Appiah, I think there is some height of, especially with the heat.
So with the heat, that's why God has made everything hang loose. There's a reason for it. So the testis is inside the balls and it's hanging outside because air has to pass around it so that the viability of the sperms are there. So if you're the type that is always wearing something tight, that will force the balls close to your skin. And sometimes when you touch your skin, you can realize that the temperature is quite different from what is around. So then you are rather causing more harm to the sperms than you think. So we are rather advised, even if you want to wear underwear, it has to be cotton, it has to be loose so that the balls can hang. There's a reason why it's hanging. So let's not change the anatomy.
There's somebody who has children in all 7 or 6 continents.
Hey.
He doesn't wear supporter. The Baba could the radio, could the TV.
Hey,
I'll follow him. I'll now follow him. Now I understand.
Yes, it's in what be hanging. So they are very strong. It's not just a call and a
partner them.
Let me just add some few numbers to this. The body temperature is what?
What is it?
What's the normal body temperature? 37. If head starting
the body temperature.
Okay, no problem.
Oh, it's very necessary.
So around 37.
So being a fever, where than one who said.
Say no where she are. Nobody was when a fever. Remember to 37, 30. Next all try 37 and when a fever.
But we have to.
I'm just even talking about the average.
Yes.
So that's around 37. But for optimum sperm production, we are looking at a temperature of about 34, 35. So God in his own wisdom, knowing very well that this sperm production is not too optimum in a very high temperature, he has separated it from the body. Have you seen balls before?
Football at the same.
Me who be the say na mama me who be that.
Okay.
Me who be the say na mama shepi.
Me mo dey always about kwatra ba ko.
So you notice that when the temperature goes very high, it will break it out. So when the temperature when the temperature gets so cold, when the temperature gets so cold that it's dropping, the body says that no, this one is still not helping sperm production. So to bring it closer to the body so that I can get some heat. You understand? So that's one cause of infertility.
Okay.
The issues of smoking, alcohol, drugs is somewhat true, but it's an investigation. I don't know if you've seen anything contrary.
Well, some of the drugs that people take can somehow like influence the sperm production. Yeah, so and even erection and things that go on, the hypertensions and the diabetes that goes on, they all affect these things. So yeah.
You want to add something to the causes in a man? What can cause infertility?
Some men, they tend to work so much with fire. So men that work around fire, the environment, even though it's hanging loose, the environment is not conducive for it.
It's all heat.
It's all heat. Men who sit for a very long time. So men who drive, the long distance drivers. So they are sitting at one place for a very long time.
And those who put laptops.
Lap, yes. And that's the new thing coming up. We have to be very careful because now laptops are around. Everywhere you go, you see people.
Ojo likes it, so he's around.
The laptop is always on their lap trying to get some work done. So we advise that you rather put it on a surface or something off.
The thing is called lap. Lap. Put it on your lap.
Okay, so then maybe don't bring it close to your balls.
So any lap be.
There be book top.
And they're fat too.
Yeah, better.
Men found too close, but heat, it won't help. Yeah, heat,
But people are saying we should have regular sex, but sometimes you have the regular sex, maybe your third one, nothing will come.
Oh, it
nothing
doesn't
will
take.
No sperms will come.
Yes.
Well, it doesn't take so much ejaculations to to get you pregnant. At least even with the one-time act. So if enough, the sperms are strong and then it comes out once. That can even get
during
a woman
what
pregnant.
Comes out is not sperms, it's semen.
The semen.
Okay.
And in the semen are sperms. And then there are some fluids that is nourishing the sperm. I'm just taking us to the numbers again. So there is a specific number of sperms a man is supposed to produce. So you can actually ejaculate like that. But the amount of sperms inside is not enough to even get a woman pregnant. You understand? So there are terms for it. It's something like oligospermia. That means that the number of sperms inside the semen, small. There's something called azoospermia. That means there's nothing inside. So the first thing that the doctor would want to do is that semen kakra. Anyhow you can bring it to us. So I have more experience than that. Bringing us semen. So when it's come, then it will be analyzed. Because when they analyze it, they're looking at a lot of things. The thing is that the egg is inside the womb. We expect that the sperms will be swimming. There are some sperms that are like this. So they go now, they are swimming back. And there are some too, they are just moving and they are staying at one place like this.
Runabout.
We've all seen it before. If you look at them, I've seen plenty. We've done a lot of semen analysis too. So that the sperms is doing like this. It can never swim to wherever it's supposed to go. So there are a lot of things that men can contribute. That's why I want to stress that issues of infertility, it's not just the woman.
Okay, we understand. Men, but are you going to assure us that if we come to the hospital, the nurses would get the sperm from us?
Well, production of the sperm is dependent on you. There are some.
Why can't your wife get the sperm for you?
Yes, I'm coffee.
The thing is that when we give you the container to take home to produce the sperm and come, you have to bring it within some few time.
That's why we need to do it in the hospital. So you move a drum.
So there are some places where
there's some rules.
There we're fine. And then we're fine away.
Okay, so
because
it's quite important
show you
for men to actually go see doctors with their wives.
And it's a one-time test. So see, if I say you say men no traditionally one time per hospital. It's open up your test one. Just say be a problem, then you have to follow up. Otherwise, once.
So that's fine. Yeah. So aside the heat and what else? The drugs.
The drugs, yes. And
what other sitting for too long? Too long.
Yeah. Stress can also be as for everybody. Stress has a lot of side effects for the body. So if a man is under stress and all that.
So if a couple is infertile, are they able to come out of it to become fertile?
Once we know the cause, we can address the cause. Understand? For some people, even in men, it can be infections, some sexually transmitted infections.
Yeah. Oh, I even forgot to mention this. There's a condition that affects the balls, like the vessels around the balls. The varicose veins. So those ones are sometimes they are corrected surgically. You see a man's balls, and then it feels like there's this bag of worm. That's what we call it. I say. Worms.
I think those watching us, they can appreciate.
There's a lot of worms in it when you touch it. I say gogomi, bebre biwom.
There are some that they are like veins on the ball.
And when those get engorged,
they can become a lot.
Okay.
And that can also lead to infection. So that one is most of the time is corrected surgically. See, what they do is that they block some of the vessels so that it reduces the number of vessels.
If you hold the balls like that, one say, I say, "Pop you on."
My balls now hold it.
I
If I hold my balls,
if I hold my balls, there are two. It'll be more there one.
Wait, there was a big one. Also go for body.
Yeah.
Well, maybe he's talking about those who get the torsion.
Debbie, make sure I don't know what I say. If you go and hold people's balls, you use a bit more there. What happens? No, some men American. Maybe I may examination.
No, say be on investigations. Investigations. I street.
Me check him out. So me say.
And I who's a video
one of them.
But yes, there are some people are more one where we call the undescended testes.
Say that again.
Undescended testes have not
undescended. It is shame.
It's still a shame. So testes
undescended testes.
that kind of testis, it can easily die. Just like how we explained, say the testis is not supposed to be close to the body. It says still like shit. Depending inside that, it ends up being a non-functional, and even can go ahead and become cancerous. So I'll use the opportunity to tell women say oh by we bema oh yeah for because I told we can salvage the whole situation if viable, like we can pull it back down. Yeah.
And confirm say when you straight no, spam near papa chain.
Oh, and also
from what we have discussed now, what we have discussed now, and it's not.
We never talk about the show.
Because when you sit down for long,
because heat.
When so
Assan produce sperm.
But it's not about when it is so. Produce ye.
Who produce sperms now? Who tie? They say, see, sperms the woman is swimming.
Yes.
It's only Appiah corner or book on a beer.
That's the last time now the swimming.
And the Appiah mui. Nah,
perception na wo krom dia.
And say boss no back so chain back.
Yeah, one can be.
And no the structure.
And what you said, it could be possible. There's a cyst, it's fine, can be around it, but which is okay.
It's okay.
Dr. Appiah, we could also zoom into why a woman may be infertile. Abortion.
It made it in a womb. You
know, Dr. Appiah, maybe I may have to say something little about that. Because the issue of abortion and infertility, we shouldn't really use it to scare a lot of people. It is true. It could cause it, especially with the MVAs.
Yes, the one that they use the QS.
MVA.
Manual vacuum aspiration.
Yeah.
On say abortion be or you the baby a shed nipa obanas ni atwe moja na free. And be so e ma omedro. Normal. There normally yana you could be some uterine scars. On say be the oya no. We atwe moja ni na free me but still not be they always be those ones no. But with in an experienced hand, you may limit that circumstances. Indeed, because as soon as somebody becomes infertile, then there's a perception say abortion, and that I have had a few in the consulting room before where, I mean, after all the investigations, we noticed that this woman is infertile at this point.
And
all of a sudden, they are thinking that there are other things.
No, but even say abortion is sometimes it's not the woman's fault. Say or share that abortion. Say you can have a miscarriage.
Yeah, but miscarriage is not abortion, is it?
It's a type of abortion.
It's a type of it. You say one share down anko say one will cause say we should terminate for you.
We call it
miscarriage.
Until
abortion is
miscarriage.
one compare drew and one doctor.
Okay.
No, the broad topic is abortion. Okay, street for no. Well, a bit how call you say a came to you try say you be evacuate. You know, your friend be iatrogenic. Not just say we cause the problem. It's a bit you can scrape and then mistakenly scrape some of the normal cells in a war uterine. To say the BB trial na a wuna a cause scar. It's a total be a cause scar na it to be FM make sa deformity no in the uterus na a cause sa problem.
Okay.
So you are right. Yeah. Abortion could.
Yes. Yeah. Some people too do not have womb.
Yes.
That is correct.
Yeah. Yes. And so there are women that are womb, they don't have a womb.
And the popular fibroid, but see another yet again, the chances of you becoming infertile from fibroid is very slim.
Very low.
But it's so easy for people to attribute infertility to fibroid.
Yes.
And people get scared. I have had numerous calls. Scanner. They say
or fibroid.
And some have broken down.
Yes. Because
but do you know that if you take 100 black women, about 80 of them may even have fibroid?
And they never knew.
And
they've given
so
birth.
there's no need for you to go around scanning people who are fibroid and non-fibroid. It is a journey to nowhere.
Yeah, but the issue of fibroid is when the thing is big and it's covering the womb. That's why you can't.
Exactly. But the question is that how many of them are that big to cover the whole womb? So I admit,
yes,
there are some fibroids. Normally the submucosal ones. There are types of fibroids. Some are pedunculated. Some are submucosal. Some are other things.
Okay.
There are some that I admit they can cover the uterine lining.
Yes.
But those ones are not a lot.
It's very rare.
And I want to disabuse the minds of people who think that as soon as you have fibroid, you are going to be infertile. Because some people have been scared because of some small abdominal pain. The doctor made them go and do
scan.
And they have forgotten everything that the scan person may have said and remembers just the fibroid because they are of the view that it may lead to infertility, which is totally ridiculous.
Yes.
Okay.
So fibroid, I agree, it can cause infertility in some cases. But the fact
rare.
that you have fibroid, it doesn't mean that you are going to be infertile. Okay. Again, blacks, especially black women, about 80%, 70% of them do have fibroid. So having fibroid is not a big deal.
Oh, we've had women who have fibroids and they have 5 children, 7 children, and all that, and it's not worrying them anyway.
Whether the fibroid is causing a lot of pain, and whether you are bleeding
too much. Sometimes too, it distorts the shape of the uterus.
Okay.
See, when the distortion comes, then it makes it difficult for in case the person will have to have a child that it will take up the space and the baby cannot grow very well. So that's when we would decide to intervene. Otherwise, the normal thing is not to go and operate on a fibroid.
So how about age?
The age of the woman.
Age too can cause.
Yes, the infertility. So, every woman at every month will menstruate. And when you do so, you reduce the number of eggs that you have. At every ovulation, every time that you're about to menstruate, you have about 25 to 30 eggs maturing to try and be the one to be the candidate to be fertilized. After that menstrual period, if let's say it wasn't fertilized, all that 25 or 30 is gone. So at puberty, we have about, for a woman at puberty, around that area, you have about 500,000 of eggs that are available. So every month you are losing about 25. You are losing about 25, and you decide to start your childbirth around 40. What do you think is happening?
You have less.
The eggs are reducing, and even the healthier ones are being lost.
As you grow, it becomes unhealthy.
No, so it becomes weak. As you are growing, things are getting weaker. Your body is becoming weak and all that. And then there are other, genetic things going on. So that's why even women that give birth very late, they tend to have babies that have syndromic and very unhealthy.
The books are telling us that fertility declines sharply after the age of 35 and even more after the age of 40.
So that's why in our definition, we don't want to wait for the woman.
If you are 35 years and you are 6 months and you've not, you don't want to say that, hey, let's give you time. Let's investigate why.
Yeah.
You understand? Because and this is not to scare anybody though, that especially somebody who's 35 and not giving birth and all that. No. Take your time and make your own reasonable decisions. We are just speaking from the perspective of a
but it's an advice.
Yes.
Give to them that know that if you don't get married before 35 or at 35,
your chances of fertility sharply
so
reduces.
Even if you don't want to marry, give birth if you want children. Healthy children.
Healthy children.
By 35.
By 35.
You have to get them.
And then by 40, dear, not just
a stop.
But miraculously, some people have given birth at 50 years.
Oh, yeah.
No, once you are not in
that's
menopause,
also
the chance of having, you can always get pregnant.
Yeah, but what I mean is that children are even healthy.
Yes.
So
it's not even a miracle. It happens. But the thing is that we are talking
your
about
chances,
probability.
Yes, there's the chances that we are talking about here.
Now, how about different types of men that you've slept with before?
So, STI, sexually transmitted diseases.
Not that. Shifting of the womb.
Shifting of the womb. How did the womb shift?
Yeah.
The womb is where it is, so it can't shift.
Sister.
No, explain it. How are they talking about it on the street?
See that? The fallopian tube is like this.
The one you've seen. Is it the natural one you see or the one you seen in the book?
The one me to have seen is like this. See your war.
So you see that.
One what to wait.
What's up with your video?
And you say people are doing it. People can have sex and the woman will start bleeding. And I said, see, when this one goes like you cannot produce.
No, it's not true. So maybe the problem here is having multiple sexual partners and then being exposed to some sexually transmitted diseases. Okay. So what will happen is that sometimes it affects the tubes of the woman. And then when it's healing, you know, there's inflammation going on. Because inflammation, say, red and it also happens in the tubes. It can even happen in the wound. Okay. You see, when it's healing and it forms the scar, okay, just like how we were talking about abortion, it can equally come together and then it will cause a block. See, so we'll show a picture that a woman is an ISN. We want to say, their friend ovaries, you know, a Gideon and chain. So a Gideon and chain. It's in some ISN. We want to say ovaries, you know, I want to chain. See, ovaries na to kosuana. I was say faster in Sanim. Net back towards the uterus. Now, it's me kata. It's a kata, but I don't know. And you say na achia. It's sometimes because of infections.
What kind
it's vagina thing.
So you're having multiple sex at night?
Yes, because of you see your vagina becomes confused.
Hey.
Because sometimes this is coming. Depends on people. Other times too, you get something like this. Way in tinny. Then you get this one. Before you can get this. So it
get confused.
You can't faster now.
When you take the structure of the female reproductive system now, so there are some ligaments are a money hanging. Unless of course ligaments are weaker.
It's not so sex in itself is not a known cause of infertility. Okay. You cannot have sex with somebody to cause infertility. And then
but
do you
know an animal called lion? What the battery, the animal eating that animal. That's right.
Debbie.
Okay.
Where
let's also stress the issue of smoking and alcohol.
Yes, smoking.
Some way, somehow, it's also noted that those things can also contribute to. So it baffles me to think that people think these things are flex. When medically it causes a lot of issues. So even smoking and alcohol, the literature tells us that no amount of alcohol is
safe. Yes.
No amount.
And even when you are somebody who takes alcohol a lot, there are a lot of people who take alcohol, they get drunk and all.
When we start talking about pregnancy, you will notice that if you drink alcohol, it can draw on the face of the baby when we discuss that.
I've seen people like that.
Okay, fetal alcohol syndrome.
Yes. Yeah. So you can have the woman's ovary having different what we call cysts all together, and then they are also having. You see, some women will have some beard.
Yeah.
They have some hoarseness in their voices and all that, and their menses are sometimes irregular. Those people tend not to ovulate. And you know, we need the ovulation, we need the egg, and then the sperm to come together. So if the woman is not producing the egg and the sperm is coming, it doesn't meet anything. You understand? So that condition, obesity, is one of the big time causes, because it's been noticed that some people, even just by losing weight, they are able to restore their body back into function. And so if there's a couple that are trying to conceive and then there is a case of obesity, we'll ask you to work on that as well.
So Dr. Appiah, as we are talking about this whole infertility, maybe we should give the women some red flags to look at. What are some of the things that when you see you want to go and then investigate. One, pain during sex. It could mean that you may have a PID, pelvic inflammatory disease, like there's an infection. I'm trying to not use too many medical jargon.
Oh, yeah, good. People are learning. Some that are student doctors who are also watching.
Okay, so there are conditions called pelvic inflammatory disease. They are normally as a result of an ascending infection.
Good.
STIs. Good. Sexually transmitted infections that move through the pelvis.
The pelvis through the tubes.
The tubes and cause infections. And those ones, when you start having them, you can have painful sex actually. Yeah. And even issues of endometriosis. You know,
painful menstruation.
Yes, painful menstruation. For some women their menses is unbearable.
Unbearable.
Their
yes.
prostaglandins are overreacting.
Let me use that opportunity to tell the public. So when a woman has their menses and then is so disabling, we would have to try and then take them to the hospital. I had a girl like that who has ignored it for a while now. Later on, we realized that it was actually this endometriosis. But you know how our people will say, if you're oba do that time now, I will say pain. But some of them are too abnormal. So I think if you see or you have somebody who is going through that, they should just have the opportunity to check, because then sometimes when you find it early, you are able to help them out so that the outcome is good. Yes.
Let's talk about the management options. So we've established that this couple cannot give birth.
No, sorry, I'm not cutting you. But is that all for the red flags?
Yes, those are the main ones.
Yeah, so they're making sure that you don't have multiple sexual partners, and the stress, then giving birth early.
Obesity. Trying to control your weight,
and then the irregularity of your menses.
Yes, you have to.
Those are the causes. Yeah. So once you are having a lot of irregular menses, you should seek help from a medical professional.
But I really like women. When women notice, a lot of women, when they notice that their menses are not regular, even sometimes when they miss, they know that my menses is 7 days. This time around it came out 5 days. They're already in the hospital. So women seeking health-seeking behaviors in women, I think it's good, and then it should be encouraged. But you have to come in, and then we will diagnose you early and then help you out. Okay. Yeah, our advice.
So then go.
I'm asking of some of the management options. Here is a couple who, for the past 3 years, have been trying to get pregnant, and there's no signs of pregnancy, no conception. What are some of the things we can do to help the couple?
So, first of all, when they come in, as we said, we'll test the man first and then also investigate the woman. And when we find, it depends on what the cause is. So when we find the cause, we would go ahead and then treat. And then some of them are just something small that you would have to do, a little surgery or some medications, and then they are all corrected. So people should come in. They should come in. They shouldn't wait. Because I've seen people who wait till 15 years.
Some of them, they are just not having sex. Let me tell you one thing that has worked for some of my patients. The definition of regular sex.
Yeah, okay.
For me, when you come, I will make you have sex with your partner every other day until the month ends.
To see.
80% of the time, they achieve pregnancy. So today, pampine. Tomorrow, rest. The following day, pampine. The next day, you rest. Pampine, rest.
That's one pair, one.
Wonder why? No, this is the case where we are going aggressive. We want you to achieve pregnancy.
So one
and they say every other day you are having sex. You understand?
When it becomes like that, I've told you I said Tokwa.
But a lot of people.
Are you talking about open sweetness and apple?
Of course, it has to come with pleasure.
I agree, but in this case, just for 1 month, we are looking for a baby.
Yes.
It is a baby. Baby, every other day.
Or call with or that them soon.
So cannot have sex every other day. I'm not talking about the length though.
When sex is too much like that.
No, Sabika, I think I spoke about that earlier on. Even if you achieve one ejaculation.
You can have one ejaculation,
and then my point is that you're okay.
Yes, for me, I'm not saying that it works for all doctors, but for me, the few I have seen and the progress report I have had, I'll tell you one story off camera.
So that what Dr. Assan is saying is very true.
Bruises.
Oh wait, that might be a bruise way.
It's also
Men are always ready to go.
Some men can have sex every day.
Ready to go.
Maybe with different women, fair enough. But they can have
If the lubrication is good, a problem you.
I'm not married.
But I agree with Dr. Assan. So we'll have to fish all those things. And then there's also the women that's after sex.
If you are in the health space,
yes,
you hear a lot of ridiculous things.
You hear a lot.
Some people raise their legs up. Some people who tell me things on the blind side of their significant other.
That's fine. I'm interested in the raising.
Yeah, some people raise their legs. That if they raise their legs, that's when the sperm will
go inside and doggy style.
The styles do not matter.
It doesn't matter. All that matters is the sperm is able to move.
There's something called the litotomy position. Have you heard of it before?
Litotomy, yes.
What? Yeah, they say.
Totonia.
All those positions do not really matter.
The position doesn't matter. It has to be the sperm. Yes. The sperm has to be healthy to move. And who here said we will raise your legs to the skies. If the sperm is not good, it's not good. Oh, I caught it.
So that's what I'm saying. We don't have to get these kind of examples because on person it's not about infertility.
This one just
okay. So are you saying that this one is on the side though? If or in him?
I just said it on the flip side. Say we will have opeja and send the aspects be cool. Send the benjamin maybe quite and it won't change anything. And we will also or send a bank on him, but bit me.
Sperm, so we are smart. Go call it that.
Once upon a time, you were the fastest sperm.
I know. And I'm still the fastest shooter of new sperms. I started the 4-4-2 formation you've given to that.
What one is 4-4-2 formation?
Oh, every other day.
Every other day, okay.
Sometimes too, the women need reassurance. Mm-hmm. You have to love them, give them emotional support.
You're right. Exactly.
When they are happy, their hormones
are happy.
Yes.
This is a good point.
That's why I'm saying that stress. I think I told you about stress. Stress for men and then women has to be managed. Sometimes, even when you go out there and then you are tired and there's a lot of stress and you come home, how your partner will receive you can even make you forget the stress out there. So support is very, very important.
Good.
Support is very, very important.
And sometimes too, some of the men, before they get married to the woman, they will be looking very nice. But on any bet ni time.
Obano.
Yes. Okay. The on person on any bet will be.
Abe man so on share boxes they be ojana hosa.
So give the men the
attraction.
Yes. So he's always seeing you. He's happy to see you. He wants another you, a mini you. So he's happy. He wants to do So do that one too. It's fine. So now we move to
the other things like IVF.
Yes, the IVF. Yes. So depending on the
we even have time to talk about this pregnancy thing.
Oh, if you don't have time, we can always do it another time. Yeah.
So depending on what we find, there are some people that maybe the tubes are the tubes are all blocked. There's nothing you can do about it. You say structural. I say. So we can take the sperm from the man, then the egg from the woman, fertilize it, and then the woman can still carry it because of a womb.
Oh, okay. If you have any other contribution or question, you just go in the comment section and then put it there. We doctors will be there to. You
will be there to.
You are Brosco told mine.
You're a good doctor.
So we'll be there to answer all your questions and then debunk certain myths and all that. So, thank you so much for coming. And we'll call on you again because we haven't finished. You have to teach us the sex position and styles that can get for pregnant women to continue having sex when they are pregnant.
All the questions are I'll be here to answer them.
Pile it up. Yes. So it's been another wonderful session on Health Quarters Ghana with the great Dr. Assan and the Dr. Appiah and the Dr. Clemento Suarez. And we are coming to you once again from the studios of Core Media Studios. And where can we be located? Westland 65 Boulevard. So please keep it locked, keep it down, clock it.